sexy sexual health panel, and my name is Laurie Bennett-Cook, and I'm so happy to welcome you to this panel. This is really a dream of mine to provide sex-positive sex education, because so much of the sex education, as you know, out there, if you Google anything on the internet, you find an article that tells you that, the best way to stay safe sexually is to not have sex, which has been sort of the mantra for a long time, or to have one monogamous partner, which of course doesn't work for everyone. And so I wanted to pull together some amazing doctors and experts in the realm of health and sexuality to answer your questions and to basically re-educate all of us, to change this paradigm that we have around sexual health to one that is empowered. So before I have these women introduce themselves, I wanted to just start with a perfect example of the sort of message that we get about our sexual health in the media. So this article was shared with me, and this was published by the Los Angeles Times in November of 2015, so just a few months ago. And the title is, STD cases reaching all-time highs in the US, California. And it says, much to the worry of public health officials, new data show that cases of chlamydia, gonorrhea, and syphilis in California have reached an all-time high. It goes on to talk about stillborn babies and really horrible things that, of course, we all read and think, oh my God, sex is dangerous and it's awful, and who knows what I'm going to contract from my next sexual experience. They even go on to quote Dr. Jonathan Merman, the director of the CDC, the National Center for Disease Control. And you can see what they do here. They quote the first half of his statement. He says, America's worsening STD epidemic is a clear call for better diagnosis, treatment, and prevention. That's all that they quote him saying. However, if we go back to the original site, from the CDC that quotes him, we see that he actually goes on to say something else, and this is really important. He goes on to say, STDs affect people in all walks of life, particularly young women and men, but these data suggest an increasing burden among gay and bisexual men. And what the research states is that we need to better understand the sexual practices of gay and bisexual men, that's actually the high-risk group that has created this. And it goes on to say that young people still disproportionately are affected by STDs. And we'll talk about some of the statistics there about that ages 19 to 25 are still the most at risk. So you see how just stating the first part makes it seem like we have this sexual health epidemic, when if you see the quote in full, you see that there are actually these high-risk groups, and they exist for a reason. They exist because they're often suppressed groups that don't reach out for health care, that are living and not able to talk about their sexual practices because they don't feel free to. So I loved this example because, even I read something like this in the Los Angeles Times and I can go into fear with everything I know. So I think it's important to see that we have to question the media, we have to question our healthcare professionals, and hopefully today you'll have some resources that you can remember back to people that you trust and respect the data that they're presenting to you. And I even have a vision that one day we could create a resource for people to find sex-positive healthcare providers. Because as you'll see from the data, it's one of the things that is especially a hindrance to the bisexual, homosexual, poly, pan, you name it, communities that aren't free to talk about their sexual practices without judgment, and therefore aren't getting the care that they need. So I wanted to start with that, and I'd love to have the three panelists introduce themselves. So Laurie, would you like to start?
Yeah, I am Dr. Laurie Bennett-Cook. My background is in psychology, and I have a doctorate in human sexuality. I primarily work as a surrogate partner therapist. I did traditional therapy for many years, not many years, but for a few years, long enough to see that there was a great need and lack of people with touch that were not getting enough touch. So I moved into surrogate partner therapy. My average clientele are people middle-aged, male, female, trans, run the gamut, that are virgins. The majority of my clients are all virgins, and most of them are virgins because of some sort of sexual shame that they have been brought up, whether it be religion or fear of STIs or just being shamed from a negative experience. So there's a lot of work that goes into bringing them back around. You know, it's a little more challenging when you're 30, 40, 50 years old and just receiving touch and coming out of that fear that you had your whole life around sexuality.
Thank you. Jennifer?
Sure. I'm Jennifer Lang. I'm a medical doctor, obstetrician gynecologist, OBGYN, and gynecologic oncologist. So that's women's cancer surgery. And I had a private practice for 5 years, which I closed last spring to run an international medical nonprofit that is establishing cervical cancer screening and prevention clinics around the world. So right now we're in Haiti, Guatemala, Kenya, Nigeria, Vietnam, and China.
Why don't you tell them a little bit more just about
Sure.
how you diagnose and what the treatment is?
Yeah. So we're using the See and Treat procedure. The organization is called CureCervicalCancer.org. We're using See and Treat, which is essentially just spraying vinegar onto the cervix, waiting 60 seconds, shining a light. Abnormal cells will light up white. We can then immediately offer an 11-minute freezing procedure with carbon dioxide gas with a 90% cure rate. And it costs pennies and saving lives. Almost 500,000 women a year are dying of cervical cancer around the world. It's totally preventable. And you know, I feel like we over worry about it in America, and it's just not addressed at all in resource poor nations. So trying to just equal that out a little bit. But just to put in perspective, you know, a woman can walk into one of these clinics once in her lifetime and have a dramatically reduced risk of having any problems with cervical cancer. So that's what I'm doing now. So I get to talk about STIs quite a bit and hope to educate people, frame, you know, the HPV discussion in a positive light. And that's me.
Thank you. Michelle?
Hi, I'm Dr. Michelle Gerber. I'm a naturopathic doctor and a midwife, which means that I'm hopeful that someday I won't necessarily have to explain exactly what a naturopathic doctor is because everyone will know. But for now, naturopathic doctors, we have a different perspective in that we look at the body as a whole. We look at it as a system that's constantly trying to get to homeostasis, and that we, as practitioners, help to sort of remove obstacles and give the body what it needs to get back to where it's trying to go, back to its sort of whole and balanced state. And as a midwife, we also approach birth in the same way. One of my favorite midwifery texts or tomes is Birth Without Fear, which is sort of the way that we, both naturopathic doctors and midwives, and both, try to approach health in general, is that we try to look at it from moving to a place of optimal health and being in all ways sort of the best that we can be, as opposed to looking at health and disease from a fear-based perspective. So I think that fits in really well with what these lovely folks are trying to do here. And a little thing that just as a tidbit about myself that anybody on the panel here probably knows. When I was in college and I was it came to me actually today, I was like, oh, of course I should be doing this. When I was in college, I was very fired up about activism and women's health and all these things, and with a couple of my friends, we decided to design I believe at the time, we titled it the Vagina Seminar, which was this standing room only, like, huge thing that we were completely blown away by how many people showed up, just trying to educate folks. But no one knows anything about their bodies or how they really work, and these things that we should all know. And so that was something that long ago I was a very intimate part of, and so I think it's kind of nice to be on the, now I have a little more information. We knew a lot, but I definitely know a little bit more now, so it's good to be back sort of in the saddle here, just in a different perspective.
And you've moved your private practice to
Silver Lake is where I practice now, yeah. Mm-hmm. Yeah.
Practicing women's
health and I see kids too.
Okay, great. So just a big round of applause. These women are all donating their time. So we're going to get started on one of my favorite subjects, which is the immune system of the genitalia. How many people have ever heard those words in the same sentence? Has anyone ever talked to you about the fact that you have an immune system there? No. They only tell you about all of the diseases and infections that could possibly come into contact with your genitals. So I want to start by educating you about the immune system of your genitals. So how do the genitals protect themselves from pathological microbes, from sexually transmitted infections? Because you can come into contact with a microbe, with a pathogen, and it doesn't necessarily enter your body. Why is that? So let's start with, talk to us about Michelle.
That might sound right up my alley, and well, as Lauren was already sort of bringing up, there's this theory that has been a part of medicine for a really long time called the germ theory, which basically said that if the germ was there, that's all you really needed to think about. That microbe was going to infect something, and we looked at that, and that's all we paid attention to. And now it's starting to change, and in the greater community, we're starting to look more at the fact that there's a lot of factors involved. And in the genitalia particularly, we have the immune system that's present in our entire body, of course, is there too. We have two big, I won't get real detailed because I really love the immune system, but I'll bring myself in. But I was actually studying immunology before I became a naturopathic doctor. So we have the innate immunity, which is the sort of like the skin, the mucous membranes, all the part that's right there at the surface that responds to any microbe or pathogen. And then we have something more specific called acquired immunity, which has B cells and T cells, things you probably have heard floated around in the media and whatnot, that specifically attack an individual pathogen, which pathogen is the bad guys. But some of the really interesting things about the immune system and the genitalia specifically, I'm going to talk, I'll mention sort of my favorite thing, which is, so the vaginal canal is really like it's like a jungle or a forest in the sense that it's this population that sort of has a whole ecosystem. And there are all these different strains of good bacteria, which again, probably this is a buzz thing out there, so you may have heard about all of our good bacteria, our probiotics, our microbiome. There's a whole sort of crew of them in the vagina that are like this little, like I say, forest or village, and they're doing their thing, and just by them being present, they secrete hydrogen peroxide and lactic acid and things that keep out bad guys that we don't want to have there. And they keep the pH a nice sort of place where it keeps them really happy, but a lot of other things don't like to grow in that pH. And so we're going to get to this a little later, I believe, but the things we can do to keep that forest happy, and just like any ecosystem, if we keep it in balance, that does a whole lot to help keep us healthy and safe. And in general, our immune system functions really well when we are looking at that other part that was kind of left out of the germ theory, which is the terrain. That's all of the things that help our immune system to be strong, which I know we're going to talk about later, so I won't go there yet. But I think that microbiome, which is present in men too. It's just that the vaginal canal specifically has got some really great just so you can hear some fun words, lactobacillus reuteri and lactobacillus rhamnosus and all kinds of other fun guys that are really fascinating protectors of that area. I don't know more about the mucosa, but I don't know. You guys have anything else you want to say about that before I just ramble on and on about the immune system?
I mean, Jennifer, do you want to jump in and talk about either the antimicrobial peptides, or maybe like how the mucosal membrane works, either in the vagina or in the penile urethra as well?
Sure. Without getting too technical, because it can be ridiculously boring. Just like, yes, the genitals have an immune system. Like we have, like every part of our body has, the immune system protects. It's in the blood, it's in mucus, it's in the skin, it's in everything. It's in the little hairs. So. We are, and I love what you talked about, the body ecosystem. I'm not an I, I'm a we, made up of trillions of organisms, and who actually create everything about who I am, including my thoughts and feelings and all of this. So I like to think of the immune system as keeping the we thriving, it's important to have, you know, a healthy, normal pH. You know, we hear a lot about like alkalinizing the body and, you know, with special water and people spending thousands of dollars on these machines and everything. We do want the vagina and the mouth to be slightly acidic. So those are the two areas. And the stomach is really important. And so that pH balance is really important for kind of the optimal survival of the forest. And yeah, like normal mucus secretions, you know, it just all comes into play.
Yeah.
So when we start, you know, interfering, like, yeah, when they sell these horrible things at pharmacies to, you know, perfume and like it's just so bad for us. Just don't do that stuff. Just keep it simple. Healthy food, sleep, you know, low stress levels, and the body is very wise. It knows how to take care of itself.
And just even some basic structural things, just like, you know, women are a little, just as an example, women have a slightly higher tendency towards UTIs, bladder infections. In men, because their urethra is so much longer and kind of a bit of a ways from the bladder, they're less likely because there's just this structural, it takes a lot for the bacteria to climb all the way up there and get to where they need to go, and so they just kind of give up sometimes. So there's some structural things too. Because I mean, I'm spending all the time talking about the vagina ecosystem, but just in the basic structure, there are some protections there, and even as Jennifer was talking about the products being bad and all that, that was one of the first things that sort of got me all fired up. I remember was when I learned that the vagina is a self-cleaning system, like it moves outward, like that's the way things are supposed to go. And so this, you know, putting things back in and cleaning it out is completely anathema to manage we want. And so there's this sort of natural movement of, just like we think about cilia in the lungs, like moving mucus out, there are always things that are kind of, one of the major goals of mucus is to trap things, dust, particles, microbes that aren't supposed to be there and just sort of move them on out. And so those are other things that obviously any mucous membrane, but the genitalia are lined with mucous membranes, and so that happens there too. That's one of the main reasons we make mucus and discharges to move stuff out.
Yeah, and keep things from entering in. And,
exactly.
And I think that language is really powerful, and so there's a couple things that I want to read, both about the vagina and about the penis, because I feel like to receive this information, it will sort of resonate with your own organs. So I love this about the vaginal flora. These bacteria maintain a slightly acidic pH within the vagina that makes it inhospitable for pathogenic organisms. I love that. I love this idea that it's inhospitable, that it is just built to say, nope, you know, you're not allowed to enter here when it's healthy. And I love this about the penile urethra. The penile urethra, from a conclusion, this is a study, I think on PubMed, and it says, limited studies on the immunology of the human penile urethra indicate, because it hasn't been studied that much, that this mucosal site is immunologically competent and capable of mounting both innate as well as cellular adaptive immunological responses. That the urethral mucosa can recognize pathogens and is capable of secreting a wide array of antimicrobial factors, which may be retained by a vicious mucosal layer. So essentially, our genitals are so intelligent. I love this. Your penis is so intelligent. Your vagina is so intelligent and capable and badass and evolved and full of all of these layers of protection and intelligence that are just built into it. And so what's really interesting are, and we're going to talk more about this, about sort of lifestyle factors that affect that. Like Dr. Lang talked about, you know, douching or different things that women put in their vaginas, which I would include condoms. And one of the things in the gift bags are the condoms by a company called Sustain, which, get this, they actually wash the carcinogens off the condoms before they package them. Because nitrosamines, the carcinogen, is produced in the cooling of the latex. So you just have to wash them off, apparently. apparently, before you package them. So things like that, diet, lifestyle, all of that is going to improve the vaginal and the flora in the body. But one thing I want to talk about, and I'd like to bring this up with Laurie, is that one of the things that we know is that sometimes that flora is just really unpredictable. Like the vaginal flora, for example, won't be balanced, and the woman is doing all of the lifestyle factors to try to balance it. And one of the things we know statistically is that bacterial vaginosis, or an imbalanced vaginal flora, is more common in lesbian and bisexual women than in other women. The reason for this is unknown. BV often occurs in both members of lesbian couples. Lesbian and bisexual women, along with BV, have higher rates of depression, anxiety. Bisexual women are more likely than lesbians to have mood or anxiety disorder. I think this goes into what Dr. Lang was talking about this world we don't understand, which is that we have more microorganisms making up our body than we do cells. So, that's why she said we instead of I. And so this sort of gets into the next question, which is, so if we have this amazing immune system that's protecting us and keeping us healthy in all of our sexual encounters, what do we do to enhance that? Because that's what we all want to do, right? So that we can be, obviously we take certain protective steps in anything we do, but how can I have confidence in the immune system of my genitalia? And I want Michelle to talk about this as well, but I thought maybe, Laura, you could start because, they're trying to understand why is bacterial vaginosis so high in lesbian bisexual women? Why is there so much depression and anxiety? And some of the factors that they think are affecting it are social stigma, rejection by family members, abuse and violence, unfair treatment in the legal system, stress from hiding some of all parts of one's life, lack of health insurance, because of course how many people get health insurance is via heterosexual marriage, having a doctor who doesn't know about your sexuality because you don't feel free to speak. So I wondered if you could talk about that, because I have a sense that if our emotions are impacting these microorganisms and vice versa, there must be some connection between bisexual and lesbian women having this vaginal flora that's off, that's predisposing them to other STIs, and sort of the emotional struggle that goes with being a part of that demographic.
Well, I don't know if it's that they're set up to have their vaginal flora off. I do know that just from the women that I've worked with, kind of by default, their play is different than within heteronormative relationships. There's a lot of sharing of toys. Toys aren't always cleaned properly, and so it's constantly the vaginosis going back and forth and back and forth and back and forth from one partner to the next. And if it gets cleared up with one person, the other person's got it. You're sharing your toys, and it's going back and forth. And then they're cleaning with soap and, not just using water. And so it's kind of like, just by default, they're kind of doing all the taking care of yourself things wrong. And then once you get into that cycle and you're like, I have to go to my doctor again, and I have to go to my doctor again, and I don't want to tell them, and then they're asking me if my partner's faithful or not, but I know we're monogamous, and then this whole stigma kind of starts to spiral there too. When really, a lot of times, it can just be so simple as make sure you're cleaning your toys properly, make sure you're not introducing douches and soaps, and most of the time we're not taught these things. Most little girls aren't even taught how to wipe from front to back. We're just not taught and told these things because we don't talk about anything that goes on with their genitalia. So a lot of it, I think, is just stigma, and they get tired of going back to the doctor. And a lot of doctors don't like to talk about anything of your sexual health and history. Most doctors, we're lucky and fortunate here, but most doctors don't ask about your sexual health. Most doctors will just say, well, you got this again, you might want to see what's going on with your partner and give you a script and walk out the door.
Yeah. So one of the things that's not studied that much is the relationship between, someone who doesn't feel comfortable with sexuality, has a lot of shame, a lot of fear around it, and sort of how that manifests in their body. Do any of you want to speak to what you've seen? I know there's not a lot of studies on that, but
there's such an eager question there that I feel like we have to.
She mentioned the proper way to clean toys. What is the proper way to
So what is the proper way to clean toys, Laurie?
Well, most toys just need hot water and that's it.
Okay.
A lot of times people will wash with soap. You can get special toy cleaners at an adult's toy store, and they'll point you to what you need depending on if you have a silicone toy or a glass toy or what they're made out of. But most toys just need hot water and air dry. Don't dry them with a towel, don't add anything, but air dry.
With regards to hot water, what I've done is actually boil water and then put it in a pot. Does it need to be that hot?
It doesn't need to be that hot.
Okay.
I know people that will put them in the dishwasher.
Okay.
Just put their toys in the dishwasher.
Thank
Not
you.
the battery operated toys. But most toys,
Good fact.
because again, our bodies being self-cleaning, we don't need all these extra things that we think that we do. And most people play with their toys and they're just like, oh, okay, or they'll play with them, or they'll think they use, antibacterial soap on them, and then they dry them with a towel, and and then, pack them away or whatever, and they don't require all of that.
Thanks for the question.
Yeah.
So,
I just also want to say,
Yeah.
I also believe that it's because of the toy sharing issue and not that they're so repressed. Or is it like anxious emotionally necessarily? I think it's just absolutely, like, we talk about BV kind of as not really an STI, but it kind of is. Like, we definitely can pass it between partners, and I've seen that back and forth and back and forth. And then, unfortunately, and my field is really responsible for a lot of this, but one of the less helpful things I think we do is write just prescriptions for antibiotics that knock out not only the particular pathogen that we're trying to knock out, but all the good guys too. And we just start a horrible vicious cycle. And so actually not making that the first approach and boosting immunity. And one thing I want to make sure that gets into the conversation is, and particularly around the immune system, so many different levels, from the cilia in the throat to the IgA, it's immunoglobulin A secreted in cervical mucus, is avoiding tobacco and smoking. It's a huge, huge suppressant of the body's immune functions. And so that's one thing that you can really make an immediate difference.
that makes sense, because bisexual women are also the more likely than lesbians and heterosexual women to smoke. Yeah. Do you want to speak to the flora being a naturopath? I know that's
Sure, that's a big part.
big part of your world. Yeah.
Well, I don't want to repeat myself from earlier, so just to sort of add to what has already been said and what we've already talked about in this particular topic. When, especially, I'll just follow up, I guess, with what Jen was saying about when a prescription is written and the antibiotic wipes out all of the good guys. With a lot of times when women come to see me and they have a diagnosis of like recurrent BV or recurrent yeast or back, it doesn't, to me, in some ways, it doesn't really matter what it's called. It's more that there's an imbalance in that ecosystem, which brings it back to an empowering thing. Like, this is not that I'm, being invaded by all these things. It's that if I can get my forest back to being healthy, and sometimes I'll talk about them like invasive species. Like, we kind of have to, you can pull out all the invasive species you want, but if the spot just stays empty, they're just going to kind of crawl back. So you got to do things to help your body to be strong and filled up with all those good microbes so that you don't continue to have that issue. It's more of although I see a lot of things this way, but I think that's a very good example of how it's about restoring the balance of that microbiome as opposed to just trying to whack-a-mole with different microbes, playing that sort of round and round game.
And do you want to talk then about, so what do you do
Sure.
with a patient to rebuild the forest?
Sure. So without, I'll start broad. So the big things have to do with just what we sort of started talking about from the beginning here, which is removing obstacles that suppress the immune system. Tobacco was already mentioned, I'll talk about a couple of others. And then doing things to help make the immune system strong and help that pH to be correct and sort of do all of the little pieces that help that forest to be strong. So from an immune system perspective, trying to remove things that, we're all about having fun here too, right? So it's not like I'm just gonna be like, no, don't drink and don't smoke and don't eat sugar. But to some extent, some of those things are the things that suppress our immune system, meaning that we just need to I always feel that, of course, knowledge is power, and knowing what we're choosing sort of helps us to make overall really healthy choices. So one thing that certainly if someone is really dealing with a lot of recurrent floral imbalances, we'll say, is to try to limit the immune suppressant things like tobacco, like sugar. It's an obnoxious one because sugar is, depending on which study you look at, more addictive than almost any other substance, and it's so ubiquitous. It's in everything. But trying to really, there was a study that looked at having I forget the size, but some sort of bolus of sugar, and watching some of the immune cells activity and watching them drop for 30 to 60 minutes afterwards. And, I always think about that, I'm like, I'm gonna have my treat, but, you think about it like a treat, not all the time, because if so, my immune system is just dropping every time. It's like taking a hit every time I do that. So same kind of, similar issues on the sort of positive side, looking at things like sleep, which Jen already mentioned. That's huge for the immune system. If we're not getting deeply restorative sleep, then that time when we're in that deep sleep is when our immune system is the most able to regenerate and restore itself and do a lot of its really good work. So sleep is extremely important. Things like managing our stress, which doesn't mean that sounds all very like, okay, thanks, doc, that's very well and good. But that means things like, I was so folks, if I could, I'd wave a little magic wand, I'd send you to a magical tropical island where you had no stress and probably all these issues would go away. But since I can't do that, we have to live in the world, and so things we can do, like, I talk with folks very specifically about meditation, and there's so much research all the time coming out, especially about mindfulness meditation and how important that is for our stress response, because we have two big branches of our nervous system. I know we're talking about the immune system here, but they're all connected. One is the sympathetic, which is the fight or flight, we're running from the tiger, or our fear of the STD or whatever it is. And the other side is the parasympathetic, which is the rest, relax, digest, immune, restore, all of the things that are about the everyday working of our body. So that is actually a really important self-care thing, is learning to manage our stress and how we approach that. I'll give a couple very specific examples, just so that we're not talking in totally broad strokes, and then maybe somebody else will want to chime in. But when we're talking about the vaginal flora particularly, obviously there are ways that we can take in good bacteria, both in terms of, actual pills and then fermented foods, things that we can take in that bring in good bacteria. Sometimes I'll actually have women talk to your doctor about this. I'm not suggesting you run out but your naturopathic doctor maybe, about restoring actual good bacteria directly to the vagina. There's all kinds of great, compounding pharmacies, which you may not have ever heard of before, do all kinds of wonderful things with, ways of putting good bacteria in. Sometimes I'll have women do very simple things that I don't like the word douche because that implies cleaning. So I usually say, vaginal rinses with things that restore the pH, like remember I mentioned before, the microbes actually secrete hydrogen peroxide. Hydrogen peroxide is something that can really help with bringing it's like you just put in the soil that the good guys really like and the bad guys kind of find a little bit uncomfortable. And so dilute, of course, yes. Right. Again, talk with someone necessarily before you just, but that's one of those simple things that can make a really big difference and doesn't kill off all your good guys and actually helps them work better. So there are a lot of examples like that.
So that's a great thing to bring up with a healthcare provider. Like, okay, I've heard that there are some other options, and you just keep talking to people until you get someone that supports you in that. I want to also talk about touch. You talked about stress, but one of the big stress reducers is sex, and so
Absolutely.
And hugs and all of this, which takes me back to the emotions and the shame and the things that keep us, held back from going after what our needs are sexually and for touch, and how that impacts the immune system. Have you seen in working with your clients, patients, that their health is improving once they're getting this touch, or once?
Huge.
Yeah. So talk to me about what you've seen, clinically with that.
But I want to go back also to immune responses and stuff like that. Something that I've found too, with those that I've worked with that have had STIs, particularly like genital warts, just various different things. But to have them shower before sexual activity, wash their hands before they use the bathroom. not afterwards. Washing our hands is such a huge thing. We go around, we're like, wash your hands, it suppresses illness and disease, and we've seen the huge decline. But people will go around shaking hands, hi, how are you, touching every little thing, and then they go to the bathroom touching their clean genitals with their filthy, dirty hands with everything they've just touched. And then they're putting whatever here. And then making sure that you shower prior to sexual activity as part of the sexual activity that they're having, because again, people will be all filthy, dirty, and whatever, and getting all over each other, and getting all up, and then right before penetration, they're like, okay, I'm gonna put on a condom. And that'll save everything. I won't catch anything now. It's like, well, you've already had your mouth and hands and everything rubbing all up everybody, and who have you been with earlier today? So yes, wash your hands more frequently, shower before sexual activity.
But what do you see with stress reduction that comes from touch? I mean, I know that I don't think there's any studies being done on this, but I have to say that when I had these chronic issues with my flora, I was not smoking, I was eating very, very well, I was getting a lot of alternative medicine, and yet there was conflict with sexual desire and all of that. So I'm wondering if anyone has the courage to sort of talk about that. How does that impact the body? What do we know? What do we still need to study? How can we get more, lower our stress through touch and sexuality?
We know that babies don't thrive if they're too touched.
Yeah, babies don't
We know
thrive,
that elderly people have a huge decline and they suffer from depression that most people in their younger in love days don't, because they're not getting touched except this medical, clinical, got to give you a bath kind of touch. When people are touched and felt cared for, their oxytocin levels get released, their stress levels, just a hug will make somebody feel so much better. And we're so afraid in our society to do any kind of touch with anything. And you can go to your doctor, you can go to your therapist, and you can sit across from them and be sobbing and crying and sharing your heartfelt deepest secrets. And they can go, oh, I'm so sorry to hear that, and hand you tissue. Because they can't touch you, because that violates any kind of licensure that they may have.
I always violate.
There's so many ways to just release touch and feel good with somebody. You can get your germs back and forth with your good, happy germs. They don't have to be
That's
just
what I'm
the
saying. I think we're
negative
exchanging
ones.
a lot of
I
positive
think we're exchanging
flora.
so
Yeah.
many positive
Because,
things.
I have a new baby, and one of the things that we all sort of know now as a culture is that you don't want to keep everything super sterile and clean. The healthiest babies have pets in the home, and I let my
dirt.
Yeah, you let them play in dirt, and yet we don't apply that to ourselves when we're out in the world. So I think there is a balance between, especially, Laurie's more connected with sort of, I think of when you're talking about like staying clean and different sort of cleanliness practices when you have multiple partners or you're in certain situations, like maybe kink situations, but then there's also just that relaxing into, again, the innate intelligence of your body. My body has this flora and it's adapting, the adaptive properties of the immune system. Did you want to say something about that?
I think that massage has been well studied in terms of immune boosting effects, and you will see quantifiable,
White blood cell.
Absolutely,
Yeah.
T-cell counts, so it's, you can understand why it's helpful, but we can also see how it's helpful exactly. And touch is enormously healing. And then, just talking about sleep quality, who sleeps better than after a good orgasm, So, it's just really on so many levels, so important.
Great. I have most of the clients that come, like I said, are virgins. And they think that, I'm not getting, I'm afraid to have sex. And we go through this whole series of exercises that involve different levels of intimacy.
Okay.
And every single one of them, at some point, they get to this point where they feel that it's becoming really intimate. And they feel the touch that they're experiencing, and then that's when they have their breakthrough. And that's when they're like, I've missed this, and they don't realize how much connection you can have just through caressing someone's hand or stroking someone's hair, and they realize that it's because of the lack of those things that they're not able to get through to the sex that they've been desiring. They haven't pushed through just these basic touch things that we all miss out on so much.
Before we leave it, because I feel like the point you made a moment ago, I'm curious about each person chiming in. This could impact everybody's bathroom habits. I sometimes have this like desire to like wash my hands with soap and then go to the bathroom, and I'm like, I don't want to do that again. And I always thought, I hope nobody hears that, that I washed before and not after in a public bathroom. Is that what you're suggesting?
I suggest doing both, but if you're gonna pick one, wash before. Just because in my head it makes logical sense. I took a shower this morning. I know that I'm like clean everywhere, but I know that I like shook hands with her, hugged her, went and said hi to 15 different people, touched door handles, held on to the guard, the rail up and down the stairs. Just all the different things that I've done with my hands just coming here today, that I don't want to go just take whatever's on my hands and touch my genitals, or go up to my partner and be like, hey, how you doing? Because whatever's on my hands is on him now, and then we're gonna get all hot and heavy, and then it's gonna be on me. So just,
Yeah.
Thank you.
Thanks for the question. And Michelle, could you just touch real quick on the type of soap? Because I don't think we're referring to anti...
Right, which is it's so hard because if you're out and about, it's very likely that you're going to be, your choices will be water or antibacterial soap, which the antibacterial stuff makes me crazy.
We have tea tree oil.
Right, exactly. Tea tree oil, lavender, thyme, all these great aromatics that are excellent, antimicrobials without doing two things that the antibacterial soap do that are bad. One of which is to strip off like everything of our own, the nice thing about those natural ones is that they are good, but they don't completely just, destroy every possible microbe that is, maybe some that are okay. Like we have good guys all over our bodies, certainly much more in our mucous membranes. But and the second thing is that antimicrobial soap has all kinds of fun, toxic and possibly carcinogenic things, and there was just a study about it making us, when we touch something afterwards that is certain kinds of toxins that are easily passed through our skin, yes, exactly, BPA and its friends tends to get into us more. So that it's one of those many things that was market driven that was a bad idea for our health. So if possible, just a plain old Dr. Bronner's peppermint lye, like basic kind of soap, that's what you really want. That's much better than those antibacterial things. You can buy, I think it's hilarious, and I was like, you can buy, there's a whole catalog of antibacterial curtains and antibacterial socks and everything you have could be antibacterial, and it's not what you want. It's not a good idea.
Do we have any other questions? Yeah, on this subject?
Can you comment on oral hygiene? Use of mouthwashes, toothbrush, toothpaste. Can you get micro lesions from brushing or flossing?
Yeah, I recommend to all of my clients prior to oral sex, don't brush your teeth. A lot of people are like, I got a hot day, brush their teeth really, really good and floss really, really good. But the same thing, you can get little teeny tiny micro lesions and everything, and then you're going down on somebody, you're kissing, you're making out, and and shaving also. A lot of people shave right before any kind of sexual activity, and that's not a good idea either, because just those little teeny tiny abrasions, any breaks in your skin is such a great defense.
That's
That's like
part of your
the best
system.
defense
It's
that you
amazing.
have is your skin. So anytime you're putting any breaks in your skin, whether it be in your gums or your skin any place, then you don't want to.
And we're going to talk more about oral sex later.
I actually
But
have a question.
Yeah, sure.
So say you yourself follow everything to the T, and you just met this new person. When do you actually worry about putting that condom on?
You can put a condom on while you're flaccid. You can, yeah. Because so many people will be rubbing up against each other, and they're humping. They've got it grinding right up in the lips and just not penetrating. But they're just right there, and they're doing oral sex, and they're just like, okay, I'm going, and then they put the condom on. It's like, well, you've already smeared whatever you got all around there anyway.
Right.
You've already shared all that, and then you might protect yourself from anything that could happen during insertion, but anything prior to that, so you can put it on while it's flaccid even too. And then you don't have to worry about messing around with it later.
And we're going to talk about that more later, but again, the condom only covers so much, and so many things are transmitted via the skin, and we're going to talk, our last subject is oral sex. So again, I think what I see is that it comes back to how can we incorporate using condoms and hand washing and healthy lifestyle with an understanding that our body, when it's healthy, has the capacity to protect itself via the skin, via the mucosal membranes, all of that.